Hello, everybody. Thank you for joining me on the Healthy Project podcast. I'm your host, Corey Dion Lewis. I have another, as always, great guest in the building with me today. We're going to be talking about something that has been um, something I've been curious about for a long time, but amongst other things, I just want you to really get to know this individual. But not only are we talking about the lived experience for to getting hired in jobs and health equity and all that good stuff, but also just chopping up and having a great conversation. I have with me Quinny Sanchez Lopez in the building. Quinny, thank you so much for being with me today. I really appreciate it.
Thanks for having me, Corey.
Yeah, no problem. So, before we get into the conversation, can you tell the people a little bit more about yourself and what gets you up in the morning?
Yeah. So I'll answer the what gets me up in the morning first. I've been preparing for this one. So I like real talk, it's actually my cat. My cat wakes up at like 6 a.m. every morning and licks my face and I'm like, okay, I'll feed you.
Time to go.
But like really like more personally, it's really trying to like improve the lives of others. Think kind of reiterating this whole sense of like lived experience. Like I am fueled a lot by like things that I went through growing up and that I witnessed other people go through.
Hmm.
And I think, yeah, like once I started working, I was like, I am committed to making sure that people don't have to like live like this anymore. Whether it's poverty or like living in abusive situations or like having lack of mental health treatment. Like I'm really motivated in just improving the lives of other people, especially people who grew up like me, like BIPOC or low income. Like these are the people that have often been forgotten. And so that's kind of really like my motivation and my focus. Um, my career has taken me from doing outreach ministry like through my church and with the Y, to ending up doing like research, field research, doing a social work master's program, taking me into digital health, and then also taking me into like research and insight innovation within digital health investment. So I've kind of feel like I've lived multiple lives just within these past 10 years since I graduated college. But there's a rhyme and reason to all of that. And I'm excited to talk a little bit more about that.
Yeah, you've done so much, right, in that time. Can you tell us a little bit, how did your lived experience influence your health equity advocacy?
Mm-hmm. Yeah, so my lived experience, if I like were to bottle up like exactly like what it is um, I am a first generation immigrant, and so like when we were also undocumented, so like there's this point in my life where like I very much understood like fear that people had in that realm,
Hmm.
and then also what it means to live as an immigrant, not just like in regards to like um, policies and things of that nature, but like okay, what are your chance of living in living like in a safe place or a place that's like
Right.
habitable? So there's that component. I think also being not just an immigrant but also being Latina, like I'm like a subset of the immigrant population, and also like what is this like being like being born in Mexico and then growing up in the United States and like being a part of these two cultures, and so relating to that. Um, Also like being an only child, and now like as I'm growing up understanding the responsibilities of like what it means to like care for
Hmm.
elderly parents. um, Growing up like with a Christian context, you name it, like having ADHD, like understanding mental health from a younger age. So like there's all of these things that come with me like whenever I go into any organization. And so what that allows me to bring in the work that I do is, you mentioned the first, like you mentioned advocacy, like that's a really big component. When I'm working with an organization, I'm thinking of like the community as a whole. I'm thinking of like those folks that have walked in my shoes, and vice versa, like those that like are walking with them. So it might be somebody that has a completely different experience than I do, but they've gone through a struggle. And like my part of that is to make sure that they're being heard. And I do that in several ways. One of them is just being a cultural translator. I was talking to my friend the other day. We were both like really involved in community engagement type of initiatives. And we both grew up in the South. Like some of the only Latinas in the room. Our
Mm,
classmates were predominantly white. Our contacts were predominantly white. But like we also still had a side of us that like was very much like you go to church on Sundays and it's with Latina people. And so we learned these two contexts. Like she was telling me about like knowing what it's like to like talk to the like um the older like southern ladies that know the yes ma'am or the bless my heart, or the ones that are like just cheering you on. And like sometimes that's like we can be taken aback if that's not like what we were raised with, or we're like what are the intentions behind that. And sometimes you
right.
kind of have to like learn to filter what did they mean, and then also explain it to other people that like may have not grown up in that context. So it's like this immigrant family, or maybe like a Gen Z person that like never had to like experience that, kind of translating like, okay, this is what's happening in this interchange, or when you go to that location, like it's almost like code switching, but like using
Yeah.
that as a
Hmm.
tactic. And unfortunately, like that's a tactic that we're all very used to, that we don't want to have to keep doing. But there are certain times when like we know it's just going to be the shortcut. And it's like,
Right.
I don't want to be here longer than you want to be here. Let's just like do the shortcut and get it done. Um, so there's that component too. And like sometimes that allows people to also build partnerships, of like, okay, like I'm able to filter out the people that get it and the people that don't get it. Um, and so like yeah, when you're young and you're like growing up in like an environment where you're just like constantly looking out for your safety, it's like okay, now I can understand how to bring that into a professional context, in the sense of like okay, I can filter out like what that person really means, or I can filter out like their intentions. Are they really just wanting to like use us for clout, or like to use their initiative to get a social media post, or like do they genuinely want to
Mm,
make a change? And so you learn to filter out like who is having like a genuine discussion, a genuine conversation.
right. Can you talk a little bit about that, the energy that it takes as someone, and me and a lot of my friends of color who are in professional settings, we always talk about how physically, mentally, and emotionally it is draining talking to your friends one way and then getting into a professional setting and having to just flip the switch
Mm-hmm.
for a lot of our professional careers. It was survival, it was just getting through it, and it's like it's exhausting being that person with that lived experience, but it's also a blessing for someone. It's weird because it's like a blessing to be able to prepare somebody who's coming into a professional setting,
Mm-hmm.
like hey, this is this is how it is.
Mm-hmm.
Did you find it physically, or did you find it like just draining for you to be able to have to like switch it on and off like that?
Yeah. I think initially I was just like happy to be in the room. I was like, I don't
Right.
care how I have to be. Like I'm just glad that I'm here. Um, but I think after like after my social work program, and like once I started like doing COVID related initiatives, and
Hmm.
getting more involved in social determinants of health, I really just was like, I don't think this is helping anybody, because they also need to know the real me. Like if I'm doing work with the community, like I need to know that, or they need to know that I'm on their side. Like,
Right.
and so there's that essence of like, I might do it with like my colleagues, but when I'm working in the field with partners, like I have to be my authentic self. And even like internally, when it's like with colleagues, or even if you're dealing with a board or something of that nature, it's like okay, like I know I have to prepare myself. Like
Yeah.
and and it is exhausting. And one thing I have been like working on is like how do I just bring my whole personality into spaces. So if
Hmm.
I'm when I was leading a facilitation for this conversation in San Francisco while I was working with Rock Health. And most of the people in that room like shared my lived experience in terms of like race and like upbringing, but like some of these folks were like CEOs, some of them were like funders, like investors, and here's little old Quinny, like just being like, "Hey, folks," or like referring to myself as a zillennial. I was like, honestly, like they might be at this different level, but like I think I've demonstrated enough of what I'm capable of doing that I don't need to perform anymore. Like this is who
Mm,
I am. Like this is what you get. Like this is why I'm able to do the work that I'm doing because all of these components are a part of me. So
right.
I've been fighting to be more myself.
Right. And it's, I wouldn't say it's scary to do that, but like you just never know how someone's going to react to,
Mhm.
to you.
Mhm.
And the first time I was able to speak in a group full of people who were at the time I deemed like super important. And I was just speaking myself, and
Mhm.
I didn't change my tone or I didn't try to look
Mhm.
for, it was just like I was just me. And I'm just looking like, okay, is somebody, what's the body language? What are people thinking? How I'm talking? And it was
Mhm.
cool. And that was the start of me being like, you know what? This is time for me to like just continue to do this because it's okay. And I
Mhm.
shouldn't have to perform, like you said.
Yeah.
That's great. That's freedom right there for sure.
Mhm. Yeah, like understanding the balance of like not everyone gets it, and for those that don't get it, like I know what I have to do, but I'm gonna like aim to be my authentic self as much as possible until it becomes the norm. Mhm.
Right. When you're in these rooms, so like you talked about working at Rock Health, and you're in these rooms with funders or very experts in different fields, and you're trying to make these changes. How do you feel like how do you feel like your lived experience shine through there? Like there are some things that you said you started out and you're doing, but how did that lived experience shine at those times?
Yeah, I think in those moments, and going back to like this aspect of like one thing that I learned a lot was just like the importance of trust building and the
Hmm.
importance of being an active listener growing up. And I wouldn't say like any of these traits are true for like every single person that's gone through things, but I think all of us bring something with us. And
Right.
so when I was in those roles, like I would be able to converse with people and I would listen. And so even if it was somebody that like was a different race or like what is it like job category than me or like different position,
Right.
it's like I'm going to take a moment just to listen to you and understand who you are, and then I'm going to work with that. And if it's somebody that like I don't really have a lot in common with, like I'm going to focus on that person and getting to know them and what they're about, because that's really what I need to do at that time. Like might not be a partnership that ends up happening, or it might happen down the line, but like I I need to build trust with that person, and sometimes it's just being the listener. And those other moments when it is folks that like have a little bit more connection with me, it's okay, like let's get into the nitty-gritty. Or let's work with what we have. I think some things that people with lived experience do really well is we can make lemonade out of lemons. Like something that
Hmm.
we do is like problem solve, and we're very innovative because like especially people with lived experience in like poverty or in low income situations, or even like
Hmm.
dealing with a lot of different um, social groups or like economic groups. It's like learning how to manage relationships with people. And so I think that's something that we do really well is like, okay, if all you gave me was that you watched Ted Lasso, or if all you gave me was that you were chief medical officer, like I'm going to work with that. And like, we're going to make a whole conversation out of just that little thing that you gave me.
Right. And you brought up some really great values that individuals with lived experience bring to the table. But I want to kind of touch on that a little bit more because I've been hearing a lot more. I've been seeing a lot more of companies really looking at
Mhm,
hiring
mhm,
individuals based off lived experience and not
mhm.
just, you know, accreditations or if they went to college or they had the 4 year degree, kind of eliminating that barrier.
Mhm.
What is the value of hiring and supporting people with lived experience?
Yeah, I think there's so much of it. I think one of the thing I just mentioned was being innovators and just being resourceful.
Mhm.
Um, Another thing too is, especially when we're talking about the healthcare industry, is like the advocacy component. I think when we see other people being mistreated or like we know something could have gone better, like a lot of times we see ourselves in that situation and we think like, what would I have wanted somebody to do for me? And whether that's like
Mm,
saying something in the moment or just saying like, okay, I need to strategize like what we can do differently. I think that's a big thing. Like one of the things that we're attuned to is like noticing the problem areas. It's like, okay, that didn't work well, or we know like somebody's bringing in like a new food assistance program to our city. Like, oh, the way that they're doing it, it's not going to work. Like, we're very good at knowing, like, they
mm,
didn't do their research. But another thing that, like, we're really good at doing once we're given the leadership capability is figuring out a solution to that. So, let's say, yeah, somebody's tasked to do XYZ, they're going to figure out how we need to get, like, the community engaged, how people are going to respond to it, because they're culturally attuned. They've witnessed things that have not gone well. I think one of the things that I'm cognizant of is like I think research is great. I'm a big proponent of like evidence based, but I do think sometimes the healthcare field spends way more money on research than it does on hiring people that already have that research in their mind. Like
mm.
we already know what needs to happen in this community. Like the 3 years you spent on that research, like I could have told you that in like 3 minutes. Um,
Right.
so I think that that's a big thing. Like, yes, let's keep doing research, but like also let's put people in leadership positions that already know what needs to be done or like have experienced ways that shouldn't have happened. A big thing is like quality control um, and effectiveness. Um, and implementation. I think I was talking to someone today and talking about how like a lot of times if you go into medical practice, you'll have a
Mhm.
doctor. Let's say they diagnose you with like diabetes or high blood pressure. Those are things that run in my family,
Right.
so it came to mind. Um, there's a big expectation that like, okay, I'm going to give you this diagnosis, now you're going to go and figure it out. Like I told you what it was, hopefully next time your blood levels, like your sugar levels, come down
Yeah.
this
Good
notch and
luck.
this notch. Yeah, right. And Corey, like with your work, like you are familiar with like the need of like we need, like the community needs guidance. Like there was already
Mhm.
distrust in going to the doctor, probably. Um, and in terms of like immigrants, like there's a language and a cultural barrier there
Right.
too. Um, and so when it comes to like actually like getting the outcome that we want, we know that it takes more than a diagnosis. I think that's one of the things that I really like to highlight are community health workers, because that's an example where
Mm,
like healthcare has really like recognized like, oh, this is why we need lived experience, because these folks
right.
don't have to convince their neighbor um, to get like their COVID test, or they don't have to
Right.
convince them that they need assistance, or because they already trust them. They're already living in the neighborhoods. They already speak the language or the lingo. And
Mm,
oftentimes they look like them too. And I think that's a big factor that we can't deny. Like racism is still prevalent in the United States. And if it's happening to us, like we're going to feel very like standoffish and like on guard if we're being supported by someone who looks different than us. Um, so yeah, I think in that context, it's
Mhm.
very important to have like somebody who knows like it's not just enough to like create a program. Like, what are all the ins and outs that we need to do to get people in the programs, that we need to get people tested? What are the hurdles that they're going to face? Like, what are the nuances that people have? I think that's another thing that
Mm.
people with lived experience know is like, let's say somebody that's like neurodivergent or has autism, like they're going to know what people who are neurodivergent need for like a conference or for a project or
Right.
for an initiative. And they're going to be able to say like, actually, like y'all have been doing this thing and it hasn't been working. um, and they're going to know the nuances. Like, not every person with autism is the same, but like as a community, like they're familiar with those things. And there does come a point where we need to acknowledge like, I don't know everything about my community, and
Right.
we need to open up about that. But at least getting a person in the door to start that conversation is going to be light years, instead of spending
Mhm.
so much time just doing investigations.
No, absolutely. And even on the advocacy side, I can see it being like, especially in healthcare, where a lot of older people will just say yes to everything, but then having someone there being like, "Are you sure you
Mm-hmm.
wanna do that?" Because 'Cause they're not gonna say no to the doctor, but they'll tell that person that looks like them, that has that lived experience, exactly how they feel, and then that
Mm-hmm.
person can speak for them. And I've
Mm-hmm.
seen that happen, like,
Mm-hmm.
they don't really wanna do this. You
Yeah.
you know what I mean? And that's a gift to be able to have somebody there that can speak for you because they know, well, I don't know if they really wanna do this, but
Mm-hmm.
they don't know how to say that to the doctor.
Exactly. Yeah, and that I had a lot of those experiences when I was an interpreter. I've been an interpreter in like refugee settings and in healthcare settings and like public school settings, but the ones that like were very um, just altering were the ones in
Mhm.
which it was a healthcare provider. Like the laws and the stipulations for a translator are that like you really are just supposed to like say what they're saying in English
Yep.
and figure it out in that language. Like, you can't really give guidance. You And there's a point into which that is helpful. But there's also this another other component where like the doctor might be talking about a treatment that the client knows or the patient knows nothing about. And like you might be like, okay, like can I pause, doctor? Like, they don't know what they need. Like, I need to interpret, like, or
Yeah.
explain to them what this is. But like, it's something that you see in their eyes. Like, the doctor might not catch that.
Yes.
And that's
Mm-mm.
really frightening. It's like, how often does this happen? I think that's part of why there's so much malpractice, is because people don't know that
Mm-mm.
they can ask questions and they don't have somebody encouraging them to, which is really scary.
Oh, absolutely. When for those companies that, wanna hire individuals with lived experience, maybe for community health workers you kinda touched on earlier,
Mhm.
or for whatever, industry, are there things they need are there, like, tools? Are there things they should be focusing on? How do you start getting those people into the door that not
Mhm.
only have lived experience, but maybe the experience that the company really wants to see? Is there some what is some of your advice around that?
Yeah, I would say for folks that don't have like maybe a college or a master's degree, or even for folks that do, that want to pivot into other roles, um, really like pinning down like, what is it that I'm an expert at? Like, maybe, and some of that is already like with lived experience. Like, so maybe I'm a very good storyteller, or I'm a very good like cultural interpreter, and that makes me a great communicator. But and so like really taking that time, and then also pairing those things with hard skills. Um, so like, let's say somebody managed, like maybe they were an oldest child or something. They had seven siblings. That was my mom's story, right? Like, they manage the household. And so that's a manager. That is a manager
Mm,
position, like writing down all the duties that you do of like responsible for the schedule, responsible for making sure that I'm like ensuring that we have enough of this product. Like I think it can be really hard to like just take time to break down like what we do in professional language. But even if
mm.
we don't do it for a job, I think it's something that like really boosts our self-esteem when we realize like, wow, I have so much to offer this world. Like
Yeah.
I should be getting paid just for living in my house, you know? Yeah, that's right. I think about that a lot with like stay-at-home moms or like stay-at-home parents. I'm like, yeah, that's a
Mhm.
real job. Like, and if you're gonna raise like your kids to like be healthy, like it's and educated in the terms of like getting reading and things of that nature, like it really does like take some routine and some planning to do that. Other skills that I would recommend to people are like looking up courses online of like project management or coding right now. So I was working in digital health, and that's something that I think is like a horizon for us. There's going to come
Mhm.
a point when like we're not going to distinguish between healthcare and digital health. It's just all kind of going to be one thing.
I
And
agree.
whether you want to get into that on like, I think for people with lived experience, getting into that and like user experience research is a really good in, or even design, because user experience is essentially almost in a way doing customer service of like where we have like all of these people that use a software, let's say Facebook, for example, or we can do
Right.
telehealth apps. They're using this software, but like, what are the things that we could improve? And a lot of times, digital health solutions are catered to people that are like Medicaid recipients or that just have like very complex health issues. And very few of the times are they making sure that they're getting the perspectives of diverse clients, of diverse patients. And so part of doing UX research is like getting on a personal level with someone, whether it's a focus group or an interview, and really understanding like what is it that you need and how is this software meeting you where you are, and then reporting that back to like the product team and saying like, this is what I heard, these
Mm.
are my suggested recommendations. We need to like, maybe the software is already in Spanish or whatever language other than English, but we need more than that. Like, we need to be more culturally competent, and these are the areas in which we can start. So, yeah. And then I would also say, like, people with lived experience make great business folks too. The
Mhm.
entrepreneurial bug is something that I'm trying to catch, but like, I know that there are some people that like are just born with it or they had to. Like, my cousin was out like hustling like used clothing in Mexico like for the longest time, and like now she's like a pharmacist like director, regional director,
Oh, wow.
because she's just like so good at like doing business. Um, she's like really good at upselling, but also just treating people really well. And I think if you're a CEO or even if you're a director, like the way that you treat people, like you cannot teach someone to be kind. You cannot teach someone to be like a humble leader that actually like tries to learn from their staff. Like you can
Right.
read that in a book and it will help you. I'm not negating that, but there are some skills that people just like have and are born with, and I think we really need to leverage the opportunity for those people and get them ramped up.
No, that's so real. You said a few things there that just kinda caught my attention, one being, um, when it comes to lived experience, there are people that that will say, "Oh, I just watch my kid. I'm just at home with the kids." Right? "Oh, I'm just at home with the kids. I'm just a stay-at-home mom," or "I'm just a stay-at-home dad." But, that is a job that some people I would just much rather pay for daycare.
Hmm.
You know what I mean? Like,
That's true.
that's a skill. That
Yeah,
is a
there's like
skill.
patience in that, or like
Oh my
even
gosh.
grit of like, ooh. like you are nagging
Yeah.
me, or maybe not even nagging me. They would say like it's like, okay, I'm on a call, but like I'll get to you. Like that is persistence and patience. Yeah,
Yes.
discipline.
Discipline. And I
Mhm.
think when I think of lived experience, it's such a equitable thing to be as a company to be thinking about, because if you look at all the people, your cousin you were talking about, like her experience, she could be the CEO of something, but
Oh,
just because she
absolutely.
doesn't have that whatever background they look for in a
She didn't go to
CEO,
college. Yeah, she couldn't afford it.
it
Mhm,
doesn't mean anything. I mean,
mhm.
there is some look. I got a college degree. I'm not saying there's nothing good in that,
Exactly.
but
Mhm,
I'm sure there are people in the world that are better than me at my job that don't have my experience or my degree.
mhm,
You know what I mean? That's just a fact. And I feel like if we want to tackle some of these social determinants and improve some of these communities, we have to look outside of that, you know, that typical job description of bachelor degree, master's preferred.
mhm,
Or what
mhm,
or whatever, because there are people out here in these communities that could benefit their community by having a job that they have pride in, and they're
mhm,
contributing to the world or their community.
mhm. Absolutely. A lot of the times when I'm doing my work, I have my mom in mind.
Mm,
And my mom is probably like the second person I know best besides myself. Um, and so if I see a solution, I'm like, what would my mom think about this if she saw it? Or how easy would this be for her to access? Would she understand what it is? And so it's like kind of thinking through those like complexities of who this individual and then also who these communities are. And that's something that I can't teach that to somebody else because I'm
mhm.
the only person that's lived that, like known what it's like
Right.
to be my mom's daughter or to like be a part of these communities. I do think that like there need to be more opportunities for these folks to get fellowships and even apprenticeships. Like if there are folks that like haven't had the chance to go to college or won't be able to, and I also think not everyone needs to go. I'm a very big fan of like trades.
Yeah.
um and so I'm like, but there's still ways that we can like be bringing people into the fold. And like we need to really create alternative pipelines. Yeah, another thing is like scholarships. Like I know we want more equity in our education system, and especially like when it comes to like our healthcare providers. I really want to see more scholarships that are based on lived experience, like
Mm,
people that like know what it's like to go to the community health clinic and wait 4 hours to get help. Like they have an experience that like we, or I know I don't, but I know that there are other people who have that, and they're going to be able to recognize like administrative things or just like what are alternatives that we can do to like evade that from happening. So I think
right.
these folks like we have so much to offer if we are given the opportunity, and there needs to be more emphasis on creating those pathways.
Oh, I love that. I love that. So, Quinny, you talked about your start in social work. You're an obvious, healthcare or health equity advocate. What is next? Where do you see yourself going from here? What are some of the things that you really want to see yourself? What are some of your goals? What is Quinny going to be doing out here? What do these streets look like?
I know. What are these streets gonna look like? I was like, I don't know. No, but really, I'm really passionate about a few things right now. In the current, in the time that I was with Rock Health, like just being together with Latinas from all sorts of backgrounds, um, who were just championing health equity and recognizing that there are very few opportunities for them to come together is something that like has left this like hole in my heart where I'm like, I really want to do something to continue bringing um, like these leaders together. And I
Mm,
think there's a need for like that within like different population groups, but I think also just like BIPOC leaders as a whole, like I think we fuel one another. I think the conversations that I've had with you have fueled me. They've affirmed what I'm doing. And hopefully like what we're saying affirms what other people are doing too. But I
Absolutely.
really want to bring more of those folks together. Um, and I think highlighting too that Latinas are not a monolith. Like we represent a variety of races, a variety of different languages that are spoken in countries. And so, really wanting those folks to feel like they're seen is really important to me. Um, I'm actually entertaining the idea of a podcast. And so
Okay.
I'm focused on like Latina health. And so I'm like, okay, I might need to connect with Corey on more of like a mentorship level on that. But yeah, I think that's like a really big thing for me. And I think that translates too into like the work that I'm doing here in North Carolina and in the Triangle. I want more folks in the area to be aware of opportunities that we have like across the healthcare ecosystem. Like you don't just have to work in a community health center, but if that's what you want to do, like I want that to be because you chose it, not because that
Right.
was the only option that you thought. Or like I don't I hear a lot from like my friend who works at UNC. It's like they've got a great medical school and there's like students that are studying to be pre-med, and they're like, I don't think I can be in healthcare because it's just not my thing. And so they're thinking about leaving healthcare completely when they don't know that there's other options for them. I think that's
Oh, right.
something that I really want to raise the flag on is if I have access to this within my local community of like educating people on like all of these other healthcare opportunities, like I want to take that because healthcare is moving fast. Sometimes it moves too slow, but like the
Hmm.
workforce itself like is going to drive the changes in healthcare.
Right.
And I really want those folks to be representative of the communities that need the help the most.
No, absolutely. Quinny, thank you so much for your time today. For those that want to learn more about you, connect with you, where can they reach you?
Yeah, I'm on LinkedIn. My LinkedIn at is like slash Q Sanchez Lopez. But we'll make sure we get the right link in the description.
Awesome. Well, again, thank you so much for your time. I really really appreciated it. And everybody, thank you for listening to the Healthy Project podcast. I'll holler at you next time.